Our speaker for today's webinar, Dr. Isaac Jumper. Many of y'all are familiar with. For those of you that aren't, Dr. Jumper is a clinical instructor in the population medicine group in the College of Veterinary Medicine. We think very highly of him. He's a very good beef cattle production oriented veterinarian, and we've asked him to continue our webinar series talking about beef cattle health today. So I'm going to turn it over to you, Isaac.
All right, thanks for the introduction. I'm gonna assume that everybody can hear me okay, and if there's any issues with that, maybe drop a note in the chat or unmute and let us know, and we're happy to try to address that. I really appreciate the opportunity to share today. We're going to talk about a couple of different topics that pertain to herd health, and particularly cow-calf operations, but some of these certainly overlap into stocker and backgrounder operations as well. So we will go ahead and get started. So every cow-calf or stocker operation is a little bit different in their goals and the what their business plan looks like, the different resources that they have available to their operation. And those are all, in many cases, their benefits, right? We all have strengths, things that we're really good at when it comes to raising the animals or caring for the animals that we do. But sometimes those can present challenges as well, some inherent challenges that might be, just due to the limitations in human labor that we have, or the limitations in land and water resources or infrastructure or those sorts of things. And so every different operation is complex in the way that it operates and the way that its business plan looks. And so when we start to think about herd health, we often think that herd health is different for every operation. And in many cases, there's never a one size fits all sort of plan for herd health around cow-calf or stocker operations. When we think about herd health, I think we often associate that with strictly just vaccines. But as we're going to talk about today, there's a lot more that involves, or there's a lot more to keeping cattle healthy than just the vaccines that we pick. Herd health systems are one of the major costs associated with cow-calf operations and stocker and backgrounders. And so, the influence that your herd health system can have on the overall profitability of your operation is profound. And so if it's something that we really put a lot of money and effort and time into, then it ought to be something that's tailored to your operation, right? It shouldn't just be, well, my neighbor does it this way, so that's how I'm going to do it. It needs to be something that addresses the specific needs that you have on your operation. And I think too often we think, well, I've done it this way forever. That's how, maybe, previous generations did it or something, and that's how we're going to continue to do it. And sometimes that's good. And there's practices and principles that they work and they're successful for a reason. But then, oftentimes new information comes available and we can change and we can do things a little different to improve the overall health and productivity of the cattle as well. So like I said earlier, I think when you, at least for me, vaccines are one of the first things that come to mind whenever we talk about herd health, but really there's a lot more involved with the health of our cattle than just the vaccine we select. And you can kind of see here, this little diagram just shows some of the different things that are involved. The thing to keep in mind is some of these things we can control and some of these things we can't control. Like, for example, we can't necessarily control the weather. I know many of you are probably experiencing some pretty extreme heat and drought right now across the state of Mississippi. We can't necessarily control that. We just have to deal with it, but we have to have plans in place that, if we've got cattle that are heat stressed right now, then we deal with it however we can, and we plan for that, and it's part of our plan, and we make arrangements, whatever that may be. We move our production system around so that we're not calving this time of year, for example, things like that can help alleviate some of the stress, or at least not compound stress on cattle that are already heat stressed right now. So other things like parasites, for example, we think that we control that fairly well, but I talk to a lot of producers that deworm their cattle regularly, but very few that actually do any surveillance for parasites in their herd, whether that be cow-calf herds or stocker and backgrounder operations. And so Oftentimes we think we got to deworm our cows when we catch them and work them. But another question that we might need to know is, well, do we actually even have any parasites in our cattle, and what kind of parasites, and where are they, in which populations of animals within the herds are they, and those sorts of things. And so nutrition is certainly another thing that is a very integral part of herd health. And I'm not going to address this too much today. I'm not a nutritionist. We've got Dr. Carson on the line here who can help answer any questions that are related to nutrition, but she and I often work pretty closely with some of these producers that we work with, because I would say 9 times out of 10, if we're dealing with a systemic health issue or a reproductive, especially, issue on a cow-calf operation, nutrition is involved in some way. Nutrition is something that if we neglect, then the immune system of that animal is not going to function properly. The animal is not going to achieve the reproductive goals that we want for that animal. There's just lots of different lasting impacts that can occur if we neglect, or if we're not paying attention to the nutrition of the animals throughout the year, right? Even in times like this, where I hope most of you have got green grass, but we still have to pay attention to some of the things about the nutrition of the herd. So anyway, my goal is that when we talk about herd health, we think of more than just vaccines and dewormers. And so this is a little bit of a thought-provoking process that we go through with veterinary students, but also with producers when we're talking about developing herd health systems. This process is called risk analysis or risk assessment. It's essentially where we define the risk. We talk about how do we manage a risk, and then we document and communicate those interventions to different people on the operation. So for example, if bovine respiratory disease is the primary risk for a stocker producer, well, we have to come up with a way that we define that, right? We figure out what is the occurrence of that disease, what is a normal level of occurrence, maybe in lots as we're buying calves, what defines an abnormal amount of disease within the population, and then what do we do to mitigate that? How do we change the way that we handle these calves? Do we delay vaccination on 30 days after arrival? Do we use metaphylactic antibiotics? Do we change the nutrition of these calves early in the arrival period? What do we do to help reduce the risk of that? And then how do we document that, and how do we do primarily 2 things: make sure that we're sticking to the plan and that everybody that's involved in the operation knows what the plan is. And then how do we actually document that the interventions that we apply are having the intended consequences, or that they are actually doing what we want them to do. Oftentimes we think that, well, we can just add a vaccine or an antibiotic, right, and it'll fix the problem. But do we actually know that it's doing what we think it's supposed to be doing? And so having some records and documenting when we treat animals, when we do some of these things, that's also very useful in these situations too. So when we talk about cow-calf operations, one of the major risks is failure of reproduction, right? If we're not, from a cow-calf operation standpoint, if we're not getting a calf born every year or thereabouts every year, that's probably one of the single biggest, drains on efficiency on an operation, right? And so from a cow-calf standpoint, we think a lot about what do we do to maintain reproduction. Now, that's a very complex talk that we could honestly spend several hours covering, but I'm going to move through some things that we can do from a herd health standpoint to protect reproduction as we go through this talk. As I mentioned earlier, nutrition cannot be ignored. Especially when we talk about reproduction, nutrition is one of the primary drivers of reproductive efficiency. Okay, so when we have problems with failure to conceive, or fewer calves born than what we want, or calf mortality early, in the pre-weaning period, nutrition is often related. And nutrition is often the number 1 factor, right? And in this little diagram here, you can see that disease is actually very rarely the only source of problems when we talk about reproductive issues on cow-calf operations. Now, frequently we can have, a reproductive problem that is multifactorial. There's more than one thing going on, but nearly every time there's a nutritional component to it, okay? And then kind of playing off of that nutritional component is the fertility issue, right? So there can be reasons that animals are infertile that are not because they're in poor body condition score, but sometimes animals are infertile or subfertile because they're not receiving the appropriate nutrition that they need, right? Then, when we rule those things out, then we start thinking about, okay, what diseases can actually lead to problems like abortions or failure to conceive. And we're going to talk about a couple of those here in just a second. But to illustrate one of the common complaints and one of the common issues that I deal with is the call from a producer that says my cows are open and they're not supposed to be open. What's going on? So when we go back and start exploring and we talk about when the breeding season, happened relative to calving, this diagram on the right side of this slide is one that I use a lot and I like, and it's a body condition score on the left-hand side of that diagram versus the average postpartum interval. So that's the average number of days after that cow calves before she will experience her first heat cycle again, okay? And so in some of these herds where cows calve in a poor body condition score, like if they calve in a 3 or a 4 body condition score, which is lower than what we would like them to be, right? 5 is ideal for a mature cow. If they calve in a 3 compared to a 5, that is a full month. That's 30 days difference. So that cow is going to go an extra 30 days before she ever comes in heat, right? And so if that's, if we have a pretty tight breeding window, well, that cow may not even come in heat when the bulls turned out, if that's the case. So how's he going to get her bred, right? So you can see that this is something that I point to a lot when we talk about managing body condition score on cow-calf operations, relative to reproductive problems, especially. Now, there's lots of things that can affect body condition, right? It's not just the presence or absence of adequate nutrition, but other things like parasites in a herd, okay? Most of the time when we have a parasite problem in adult cows, right, it's a problem that's present with other issues. Very rarely do we see, adult cows that are clinically parasitized unless there's some other problem with nutrition or some other disease or some other reason that animal might be immunosuppressed or their immune system's not functioning properly. Right. But then other things like the ability to forage. Sometimes we get some of these older cow herds that, they're either, short teeth or broke mouth, and it gets hard for those cows to actually eat enough each day. So if you compound that with a poor quality forage or something like that, then those cows they can't keep up. Stage of production, obviously, lactation versus gestation, there's different nutritional requirements, and then other diseases as well. And we're going to kind of talk a little bit about that. So when we're talking about problems with fertility on cow-calf operations, we move through these different points. We start with evaluating nutrition, then we evaluate the bulls, right? Are we doing breeding soundness exams on bulls every year? Do we know that that bull is capable of settling a cow, right? He may be capable of breeding a cow, but is he capable of actually settling a cow as well? Evaluating cows, do we have cows in the herd that, are these kind of chronic offenders or repeat offenders of, they don't calve every year, but they calve every other year? That could point to a problem with just the inherent fertility of that cow. And then how do we manage replacement heifers in the herd? Are we managing replacement heifers in such a way that we're selecting for highly fertile, early maturing, early puberty females that can go into the herd, get bred in a timely fashion? There's a good bit of research out there that demonstrates that one of the major factors that drives longevity of a female in the herd is when she has her first calf. So if she calves early in the calving season relative to her cohorts during her first pregnancy, she's more likely to stay in the herd for a longer period of time. And if you think about that, that makes sense, because if that heifer calves very early in the calving season, she has the maximal amount of time to get bred back. And that then sets her up to get bred early in the next breeding season, calve early in the next calving season, get bred early, calve early, and continue that cycle for the rest of her productive lifetime. Okay, so it's hard to know these things if we don't have a little bit of data to do it though, right? If we're investigating a problem with reproduction in a cow-calf herd, we need a little bit of information. And so I often tell producers that, there's some things that we can write down on a daily basis that are not complicated, and we don't have to have real fancy or sophisticated record keeping systems to be able to capture a little bit of very meaningful data. So for example, if we just know the days that calves are born or the days that we find new calves, maybe we know how many calves were born in the last 5 days, right? We at the end of every week, we count up the number of new calves that we've got, and we write down that we've got, 15 or 20 new calves born in this past week. If you know a little bit about when calves are born relative to the breeding season, when the bulls are turned out, we can do a lot in terms of assessing reproductive efficiency. How quickly do those bulls get the cows bred? Is there any pattern to, this particular pasture of cows tends to get bred later in the breeding season than this pasture, or these older cows don't do as well as these younger cows, or in some cases, these heifers are not getting bred as early as these older cows, right? We can really ask a lot of questions about reproductive efficiency on a cow-calf herd if we have something like even pregnancy check data, right? If we're pregnancy checking these cattle mid-gestation, we know who's bred and not, and we have an idea of what stage of pregnancy those cows are in. But really the gold standard for that would be if we know when calves are born, then we can, subtract 283 days from that calf's birthday and figure out when that cow conceived. And that can tell us a lot about how efficiently our breeding season progressed. Okay, so this is again what I mentioned earlier about, the factors that influence how long a heifer will actually stay in the herd. This is another graph. It's a little bit older now, but it's kind of one of those very well-known studies out there. But the ultimate take home to this is that when a female calves late in the calving season, she is at risk of calving late the next year or not breeding back. And so you think about it, if we've got females that are chronically calving later and later and later in the calving season, well, eventually they won't get bred, right? Because if they calve late, then they achieve estrus cyclicity late in the breeding season. And so eventually, if any one little thing goes wrong, like, right, if that cow's a little bit lame one spring, or she's a little bit thinner or something like that, or if she gets a little, mild case of respiratory disease or something, any little thing can push her out of the breeding season and she ends up open. Okay, so we're going to talk about a couple of diseases fairly briefly. Both of these diseases that we're going to really focus on today have reproductive consequences. The first is Trichomonas fetus. I'm sure this is one that many people have heard about. This is a disease that in the past several decades has really moved from the Western U.S. really across the rest of the U.S. And that's because we've moved cattle, right? The rate at which cattle move today means that we have kind of created a problem with Trichomonas fetus by bringing cattle all over the U.S. and moving cattle around. And so Trichomonas fetus, we know it really is trich, right? Trich is actually a protozoa. It's not a bacteria, it's not a virus, it's a little protozoa. And it's a venereal disease, right? So it is spread during the act of breeding. It's spread during natural transmission, right? It is not spread during artificial insemination. Okay, most of what we know right now is that the current methods of freezing and collecting semen are not conducive with survival of the actual protozoal organism. So this is primarily a problem in naturally bred herds. One of the major issues with this is there's really no clinical signs. You don't know that a cow's infected until she has an abortion. Okay, until she aborts that fetus, you really don't know that she's infected. And if your bull is infected, there is no way that you can know he's affected. He has no clinical signs whatsoever unless you test him and find that he's infected. Really, there's no other way of determining that aside from testing. So there's some biosecurity things that go along with trich, because trich is one of those diseases that does not live in the environment. The only way it can come into a cow-calf herd is by bringing animals in. So it's one of those things that we say it either comes through the gate or over the fence, but in most situations it's bought and paid for, right? We bought a problem and bring it in and brought it into the operation. So for example, if you buy a bull from the stockyards in Mississippi, if he's over 18 months, he's got to be tested before you can actually turn him out, right? And the Board of Animal Health will follow up with you and make sure that happens. Any virgin bulls that come with a virgin bull affidavit are exempt from that, right? If you're purchasing a bull that is under 12 months of age, or he's a virgin bull, then you don't have to worry about that. But in general, my recommendation to producers is, even if you're a closed herd and you don't buy anything, it really doesn't cost much extra to go ahead and trich test your bulls every year, because we all know that bulls are good at breeding cows, fighting and tearing up fences. And so eventually a bull will get out and get with a neighbor's cows. And even if you get them right back, there's a chance that he could have contracted trich. And once a bull is infected with trich, that bull is infected for life. There is no way to cure him. Currently, we have no method of curing bulls. He'll be infected for life. So as an insurance policy against an entire calf crop, when you do breeding soundness exams on your bulls, your veterinarian can very easily pull a test and do a test. There's a couple of pictures here of us doing that. Really, all we do is wash the prepuce, collect a sample of fluid, put it in the pouch, and ship it to the diagnostic lab. It's as simple as that. And so honestly, that little bit of diagnostic testing is an insurance policy against an entire calf crop. That's the way that I look at it, because going from a, in best case scenario, 95% calving crop down to a 40 or 50 or even less percent calf crop, right? That the difference in, especially with cattle prices, what they are right now, the difference in that number of calves that you'd wean and sell will certainly pay a small fee to test these bulls. Okay. All right. So like I said, the testing is not complicated. It's actually really simple to do. And our diagnostic lab here in Mississippi does it every day. There is, and actually, I'm not even sure that this product is on the market anymore. Maybe somebody on here is a little bit more familiar with it. We don't use it here at the CVM. This is a product that is out there, but trick is a good example of a disease that we can't reliably control with a vaccine. So this vaccine, even on the label, will tell you that it's not necessarily meant to prevent infections, but it's meant to use in the face of an outbreak to try to limit the number of cows that will actually abort, right? Or help them develop an immune response a little faster so that we can then get them bred and get them settled, okay? So there's very few cases where we can rely completely on a vaccine to prevent disease. And this is certainly one where I tell producers that I don't necessarily think this vaccine is the best method of preventing trick. I think the best method is good biosecurity and not actually bringing it into your herd to begin with. Okay, so a little bit about biosecurity in general, right? The colloquial term for this, is biosecurity. It's, most of the problems with biosecurity happen when we bring new animals into the herd, right? Sometimes we have closed herds where we just have animals that, a neighbor's bull gets out and tears up a fence and gets in with our cows. Well, that's a breach in biosecurity, but it's not necessarily our fault, right? Sometimes things like that just happen. But in general, when we're talking about some of these things, buying, bred females from sources that we don't really know the health behind them is a risk. You could bring in something like bovine viral diarrhea virus that we're going to talk about here in just a minute. If you rent or loan or borrow bulls that, don't necessarily know the cows that they've been with, that's a risk for bringing in things like Trichomonas fetus. Right. So in general, it's just a good idea to know where the cattle are coming from and then quarantine them for an appropriate amount of time. Okay. Now, everybody always asks, well, how long do I need to quarantine an animal? And the answer is there's not a set time. If I'm worried about bringing bovine viral diarrhea virus into my herd and I buy a set of bred replacement heifers, well, then I'm going to quarantine those heifers all the way until they calve. Okay. And they may be, that may be over 100 days, but the risk is that heifer is carrying a persistently infected calf. And when she calves, then that calf is a source of BVD virus to everybody else in the herd. So the time that we need to quarantine depends on the disease that we're worried about. And so that's a conversation that we're happy to help you with. We have those kinds of conversations with producers all the time that, they say, hey, I'm thinking about expanding, purchasing this set of females. How do I need to handle them? What do I need to do? And so we talk about that, what's the disease risk in the set? And then, what are we worried about you introducing into your herd, and how do we do that? And the same thing applies to stocker and backgrounder operations, right? Because, if we've got respiratory disease viruses floating around in a set of stocker calves, we don't necessarily want to buy them and dump them out with a set of healthy calves because we may create disease all over again, right? Okay, so the fundamentals, I tell people that a good herd health program is only as good as the biosecurity program that exists within it, right? Because biosecurity is the weak link in the chain eventually. You can have the best vaccine in the world, you can have the best health of these cattle in the world, but if you continually challenge them with disease by introducing new animals into the herd that have disease, eventually you will have a disease outbreak every single time. So biosecurity is probably one of the most important components of herd health. And unfortunately, it's something that we probably don't pay as much attention to as we should. Okay, so there's different ways, and this is this diagram on the right side of the screen is what we call the epidemiologic triad of disease. And so it's just a way that we think about how disease occurs in populations of animals, right? We have the agent, which might be the bacteria or the virus, or in Trick's case, the protozoa. We have the host, which is the animal, and then the environment that they're in, okay? And so sometimes We have agents that live in the environment for a long time, things like Johne's disease or salmonella, and we have to worry about. Sometimes the agent is the primary problem. You know, we're bringing it into a population, things like trich and BVD. But then sometimes the host is the issue, where we have a host that's immunosuppressed. Their immune system's not working because they're malnourished, or because they have some immunosuppressive disease like bovine viral diarrhea virus that then creates an opportunity for them to get respiratory disease or gastrointestinal disease or something like that. So when we talk to producers, right, there's various strategies that we have about reducing disease. Sometimes we reduce host susceptibility to disease, right? We can do that with vaccines, with good nutrition, those sorts of things. But in other situations, our goal might be to remove the agent from the population and keep it out, right? That's with BVD. We can, if we have an outbreak of BVD, we're not going to vaccinate our way out of that. We've got to test and cull and remove animals from the herd and then keep it out. And then in other cases, it's preventing infective contacts, right? So if we have an infectious disease in the herd, then we're trying to prevent contact between infected individuals and non-infected individuals. And that's kind of breaches on a topic that we know is biocontainment, right? We're containing the infection within one subset of a herd and not allowing other susceptible animals to come in contact with infected individuals. So bovine viral diarrhea virus is, honestly, it's a pretty fascinating disease process. It's not good when we have an outbreak of it, because it can be devastating in both cow-calf operations and stocker producers and backgrounder operations. I'm sure some of you may have some experience with this. It's a bad deal, but it's 100% a biosecurity disease. The virus does not live in the environment. The only source of virus is infected individuals. And so the only way that it can come into a herd or an operation is by purchasing or bringing in individuals that are infected. There's 3 types of infection. The transient infection is the most common. This is the one where, you know, you've got a set of stocker calves and there's BVD virus floating around and these calves get infected. If they live, then they eventually get over it and they're not infected anymore. Persistent infection is the PI calf. We all probably are familiar with that terminology, like the PI calf. But this is a very specific type of infection that occurs when a pregnant cow is exposed to a specific type of BVD virus between the ages of about 50 and 150 days of gestation. Right in there, there's some debate about when it is, but it's really mid-gestation. When that infected cow is exposed to that virus, the cow develops a transient infection, but the fetus itself becomes persistently infected. So the cow will get over the infection, but the fetus that she's carrying, that calf, will be persistently infected, so that when she gives birth to that calf is continually producing virus and shedding virus for its whole life. It will shed virus, right? And it is a source of virus to all other animals in the herd. And so oftentimes when we see outbreaks of BVD, we see outbreaks during the calving season, because a cow will lay down, have a calf that's a PI calf, and then all of a sudden we've got an outbreak of calf scours or an outbreak of respiratory disease in these cows, because we have a PI calf that's shedding this virus to everyone else in the herd. And it's named a little bit, it's not necessarily named. This is one of those historical names that when they first discovered and were working on BVD virus, they noticed that it created diarrhea, severe diarrhea in dairy cows. Well, come to find out, it wasn't the BVD virus, it was actually creating the diarrhea. BVD is incredibly immunosuppressive. It kills the immune system for a short period of time. And so what was happening is these dairy cows, their immune system was not functioning properly, and they were developing diarrhea from salmonella, from some other secondary bacterial infections of the gut. Okay, so it got named bovine viral diarrhea, but diarrhea is actually not the primary thing we see with BVD. We see immunosuppression. That's why we'll have outbreaks of respiratory disease, right? Because all of a sudden these animals have a non-functioning immune system, and they're very susceptible to respiratory disease or other GI disease or those sorts of things. So I like this little image because, right, that persistently infected calf is like a ticking time bomb. Eventually that cow is going to have that calf, right? And then that's when we're worried about spreading that virus to the rest of the herd. That is all the more reason to protect the pregnant cow herd, okay? So if we've got to purchase individuals and bring them in, right, that pregnant cow herd is the section of the herd that you've got to protect the most from a biosecurity standpoint. Right? Because if we bring anything in, even if it's something like IBR virus, right? IBR can create abortions. Leptospirosis can create abortions. Neospora canine. There's a long list of different things that we can bring into a herd that can create abortions. Or if we bring BVD in this case, right, then it can create a persistently infected calf. And it's a very much a delayed kind of consequence situation, because that cow may be exposed early in gestation, and then 6 months later she has that calf and you have an outbreak of disease because of a decision to bring animals in 6 months prior, right? So there's a delayed effect, and it's often hard to realize that a decision that I made 6 months ago to bring in these animals resulted in this outbreak of disease that I'm having now. Okay, so we're going to talk just briefly about some vaccine things, and this kind of wrap up the discussion point. I'm happy to try to answer any questions that we might have. Vaccines, when we're talking about reproduction on cow-calf herd, they are a tool that we have to protect against things like early embryonic death and abortion. Now, like I said earlier, vaccines are not silver bullets, right? We have to have appropriate expectations for what these vaccines can do, and then we have to use them in accordance with what the vaccine label says, or else they're not guaranteed really in any way to do what we want them to do. So there's things like IBR, BVD virus, like we just talked about, leptospirosis, Campylobacter. These are all things that are commonly included in like a respiratory 5-way vaccine. So if you're given, a 5-way respiratory vaccine that has a VL5 HB on it, that VL5 would be Vibrio, which is Campylobacter, 5 leptospirosis, and then if it has a HB on the end, that stands for Harjo-bovis, which is another leptospirosis that's specific to cattle. So when do we think about that? Well, here at the university, when we think about maintaining the health of the university-owned animals, we vaccinate twice a year. We vaccinate at preg check and pre-breeding, okay? And for our university animals, we will often do our pre-breeding vaccine will be our respiratory, and then whatever our reproductive component is, the Vibrio, Lepto, that'll all happen before we breed the cows. Okay, that way we've got protection of that pregnancy early on from any of those respiratory pathogens, plus those abortive pathogens like leptospirosis and Vibrio. And then when we preg check those cows at approximately mid-gestation, we'll booster their clostridial vaccine at that time, and then we'll booster their just specifically the leptospirosis portion, because lots of the lepto products that we have, the duration of immunity is not for the full gestation, full length of gestation, the 283 days approximately of a cow's gestation. So we need to booster that at some point, and that's just, it kind of depends on the product you're using. So I'd encourage you to look at the label, read the label of the product that you're using, and do what it says in terms of recommended boosters. But then when we talk about, modified live versus killed vaccines, I get the question all the time about which is better. And that's not a good question to ask, because you can't compare the two. They're just different. And in some situations, a killed vaccine is better than a modified live, and vice versa. They're just different. They stimulate different kinds of immunity. And there's some situations where I absolutely will not use a modified live, and there's some situations where I will not use a killed vaccine. Again, that goes back to, we have to figure out what's best for your operation and what your goals are and what we can achieve there. For example, like if we can't necessarily confirm that we're going to give vaccines every year at a reliable time, and we know what's happening, I'm reluctant to use a modified live in that herd, because modified lives will create abortions in cows if they're not used exactly how the label says. So that's just an example of, when we would do that risk assessment process and figure out, okay, what do we really need to do from a vaccine standpoint? Parasites are something that we don't necessarily think about when we think of vaccines, but I put this slide in here to illustrate the fact that parasites can have a big impact on the ability of your vaccine to do what it needs to do. In short, parasites, they create an immune response in the animal. The immune system of that animal is trying to fight those parasites. So especially in calves, like spring-born calves, if we're getting ready to wean them in the fall, there's some work out there that says it takes about 2 grazing seasons for that calf to develop some level of innate immunity to those parasites. And so if that calf has a parasite burden, a gastrointestinal parasite burden, right, and you give it a vaccine, that vaccine may not work as well as it could have if you eliminated the parasites first. So I always recommend that we try to get at least one round of dewormers in these calves, at least before they get the booster, right? So if we're gonna get these calves and work them twice, like if we work them, give them a dewormer in their first round of vaccines, turn them back out, right? And then get them back out up a second time with, and actually separate them from the cows that time, give them their booster vaccine then, and we've hopefully, removed a good bit of the parasite burden with that dewormer that we gave the first time. Okay, so vaccine tips. Again, right, we can have the best product in the world, but if we're not using it in a good way, and we can't expect it to do what we want it to do. So always follow BQA guidelines, right? If you're given more than one vaccine, try to split it on both sides of the neck. It does a couple of things. It prevents the vaccines from interacting with each other, and it also stimulates more than one lymph node system right on either side of the neck. Be mindful of what you're given. In many cases, we have to give some vaccines on the same side of the neck, right? Because we may be given 3, for example. We put 2 on one side and 1 on the other. Just make sure you know what you're putting on the same side. For example, if I can take a modified live and put it on the opposite side from a dewormer, for example, I try to put a modified live by itself. And if I could put like a Clostridial vaccine and a dewormer on the other side, that's what I'm going to do. Because that dewormer or the adjuvant in a killed vaccine can interfere with the ability of the modified live vaccine to actually do what it needs to do. In general, we prefer sub-Q routes as opposed to IM. And I really think most of the products on the market today have actually gone to a sub-Q label. Sub-Q is just under the skin, right? It's not in the muscle. And under the skin creates less tissue irritation. It's less from a carcass quality standpoint. This is a big deal for the stocker and backgrounder guys, because these calves will go on, and we don't want to be selling a lot of calves that have got big carcass lesions or things like that. So the label instructions will always tell you if a booster vaccine is required, but in general, a minimum of 3 weeks before you booster them is necessary. Things like making sure that the vaccine stays out of direct sunlight, make sure it stays cool, those sorts of things are important. The appropriate needle size is important, right? If we're going to give a sub-Q vaccine, most of the time a 16 or 18 gauge needle that's either at, a half or 3/4 of an inch long is plenty of needle. We don't need anything more than that. We want to clean these multi-dose syringes, right? If we're using some of these pistol grip sorts of syringes, we want to clean them well in between workings, but try not to put any disinfectants in them or any kind of soap. If you do, make sure you thoroughly clean all that soap out of there, because if you don't and you leave a residue of some of that in that syringe, even if it's a small amount that you can't necessarily see, the next time you put vaccine in that syringe, it's not going to work as appropriately, right? That disinfectant can inactivate some of that vaccine. Okay, so in general, like I said earlier, cows, we typically work 2 to 3 times a year. Pre-breeding and weaning, typically weaning and preg check happen at about the same time. So pre-breeding and weaning would be 2 times a year, right? In those, our pre-breeding vaccines are often our combination respiratory plus the reproductive components in the leptospirosis and the Vibrio. And then preg check, we typically booster the leptospirosis. That's when we would give a Clostridial vaccine as well. And again, I'm not meaning this to be a prescription, right, or a kind of a recipe. This is just what we do here at the university. And so you may need to do something different on your operation, right? We tailor this to the needs that we have for every cow-calf herd. And I would just encourage you to visit with your veterinarian about, what would be the best option and when you need to do these different things, okay? And then don't forget about the bulls. We often do. Sometimes these guys get neglected a little bit, but they also need regular vaccinations too, especially if you're moving them. Like if you've got cattle in different locations, different herds moved around, and you move bulls from one herd to the next, they need to be vaccinated, because there's a little bit of stress that's associated with pulling that bull out and putting him in with a new set of cows. So don't forget about the bulls, would be what I would tell you too. All right, I appreciate it, and I'm happy to try to answer any questions that we might have. I know that was kind of quick and fast, but I appreciate the opportunity to speak.
Dr. Jumper, I think there was a lot of good nuggets in there, definitely. If anybody has any questions, now would be a good time for those. I know some of our internet connections aren't great, so if you'd rather put it in the chat box, feel free to do that. or hop on, turn on your video, unmute yourself and go ahead and ask some questions.
Hi, Isaac, quick question.
Yes, ma'am.
Would you remind me about PI testing? Does a veterinarian have to take the ear notch sample to send it, or can a producer do that?
Good question. No, that does not have to be done by a veterinarian. Producers can get the ear notchers and take those. My usual recommendation is either talk to your veterinarian before you do it or check with a diagnostic lab, because there's some specific ways that we want to ship those samples and how you want to, put them in the fridge and that kind of thing, how you want to handle them before they get sent to the diagnostic lab to make sure that you get accurate results. But no, that's not something that has to be done by a veterinarian. It's usually good to let a veterinarian know that you're going to do that if you've got somebody that you work with, or, we can help you with that at the university. Honestly, a lot of the calls that we get are about, PI testing, BVD testing in herds. How do we do it? What do the results mean? How do we deal with the situation now? So we're always happy to help if or if you've got a producer, or if you yourself are dealing with an issue with BVD, we can advise you through that. And in most cases, we lay out how the producer needs to collect the samples, and then they ship them to the diagnostic lab, and then we're just consulting as we get results back about, where do we go from here? What do we do now? So.
Awesome, thank you.
And my email's up here too, so if anybody's ever got a question, I'm more than happy to visit with you. That number on the screen is my office number, and I check my voicemails on a daily basis. I just don't always get a chance to return the calls that day. So if you really need to get up with me, email's probably the best way. So.
Quite a few extension agents on, kind of scattered all throughout the state. I know one of the things that agents face and hear a lot from producers is lack of access to a large animal veterinarian. I know in your position in the vet school, y'all are doing some work with herds, but in terms of a recommendation, obviously you can't be in every part of the state, nor do we expect you to be. But what do you think agents should kind of share with producers if they're having some issues finding a veterinarian?
Yeah, I mean, that's the world we live in today, unfortunately, and that's a problem that we are well aware of. And I wish there was a quick fix, but I don't know that there is. And honestly, the direction the industry is going, I don't know that it will. I don't know that we'll ever have it completely fixed, honestly. So I think the message that I have is that makes preventive care all the more important, right? The things that we can do to try to prevent outbreaks of disease or problems in general, health problems in general. Obviously, we can never be perfect in that. We can never create a zero risk situation, but the things that we can do around herd health to maintain the health of these animals, to not have disease problems, right? That's all the more important when, access to veterinary care is a problem. I'll say that, that's something that the CVM is really concerned about, and we're moving towards developing a center for rural veterinary medicine that would specifically train students to go into rural parts of Mississippi and be successful in practice. And so that's something that is in the process now of developing a program that would address that problem. But I'll say that, in my position, that's one of the purviews of what I do, is to try to reach out and help producers that need advice. And so if any of the agents on here ever have a producer that's struggling with a health issue in their herd and we can help advise, we go all over the state taking students, and we do so with it's our population medicine group. And so we don't necessarily provide primary care when we do that. In some cases we can, kind of depending on the situation. And so, you know, if it's a situation where we have absolutely no access to veterinary care, I would say if you got a problem, reach out to us because we can, most of the time we can help and we will. And if you reach out to me, then we'll come visit and we'll do what we can to help and try to fix the problem. You know, most of the time, the issues are complex and they're difficult and there's not an easy solution out of them. But really in summary, that I think that the lack of veterinary care really highlights the importance of preventive medicine, right? And preventing disease and things like biosecurity and using our vaccines appropriately and maintaining nutrition of the herd and all of those things. And, you know, we're more than happy to try to help put together a plan to do that in any time that we have that need. So.
Appreciate you kind of explaining a little bit about the population medicine group and kind of what y'all do, because I know I'll be honest, before I started working with y'all more directly, I didn't really understand the purpose of that group or kind of what y'all did. And I think y'all offer a valuable service that could help a lot of producers in the state. So I appreciate you sharing that. Any
Yeah,
other
that's-
questions?
Anybody else?
Y'all are a quiet group today. I guess that means you answered them all.
Yeah, hopefully so.
Okay, well, you've got Dr. Jumper's contact information if anybody wants to reach out after the fact. We appreciate y'all spending a little bit of time with us on the webinar. And I will hopefully by the end of the week work on having this recording shared with y'all as well. So with that, we'll go ahead and sign off. Oh,
Very good.
looks, Brad has a question in the comments before I sign off.
Gotcha.
So,
Any confirmed anaplasm in Mississippi last year to note. So I don't know the numbers, but yes, I would say we diagnose anaplasm in Mississippi every year. I'll put a plug in for this too. If any of you ever have herds that you think are anaplasmosis, you have outbreaks of anaplasmosis, I would really like to know because we've got several research projects going on right now that deal with anaplasmosis. And so from a research standpoint, I would really like to know. I know that I looked at the data from the diagnostic lab in Pearl a couple of years ago, and there was something like, oh, I'm going to mess it up now, but there was a couple hundred samples that were positive. And I actually had we did a study where I tested a bunch of herds, 40 herds from across the state. Some of you actually helped me enroll herds in that. And we found, I think all of the herds except 4, I think, had anaplasmosis present in the herd. The trouble with that is now, like if an animal tests positive for anaplasmosis, that doesn't mean that's the cause of whatever disease you're seeing, right? They're just a carrier for anaplasmosis. It doesn't mean it's going to create disease in them. But in short, yes, we see anaplasmosis every year, and we're really approaching the time of the year when it's most likely, this late summer, early fall. So if you know of producers that are struggling with that, let me know, because from a research standpoint, I'd be interested in visiting with them. But then we also work with a lot of producers to try to figure out ways to manage that, because it's a frustrating thing. Honestly, it's not an easy disease to manage.
Dr. Jumper, this is
Yes,
Lulu in
ma'am.
Jones County. My brother-in-law last year, they're in Beaumont, Perry County, and they lost quite a few cattle to anaplasmosis. And I know because I helped them diagnose, and we send the exams to the lab. They had pretty, we controlled the disease, but they were still dying of anemia and, of the outcome of the disease. So I know on that area about a year ago was pretty rough. End of summer, they lost quite a few head. So
Yeah. Well, hopefully it's gone. Right.
Yeah.
But if they and producers like that, if they if they have plans to work those cows anytime in the future, and they wouldn't mind me getting a blood sample from a research standpoint, if any of you know of producers like that, please let me know, because I'd love to kind of continue some of this work and just get some survey blood samples from some of those cows. So,
Yeah, I know he would be fine with that. I usually help him work the cattle, so if you have any information, you'll have a time of the year or something like that, just send it to me and I'll
yeah,
work with him on it.
we're pretty, that project is kind of ongoing. And so honestly, anytime this fall or next spring,
Okay.
you just let me know and we'll show up.
Okay, I'll talk to him and let you know.
Thank you.
Good connections. So I'll give one last call for questions. Brad, I appreciate you. Hey, your mic's out. But I appreciate your comments and bringing up some good discussion. I think that was a good point. Anybody else? All right, well, we are right at noon, right at lunchtime, so we'll go ahead and sign off. Thanks, Dr. Jumper. We appreciate you being with us today.
Hey, I appreciate the opportunity. Thanks you all for taking a little time out of today. I appreciate it.
Thank
Okay,
you.
thank you.
All right. Have a good day.
Bye.
You too.